being a teacher and a professor at a local community college, I never thought that I would be one to become addicted to those opioids.
You are not alone, I'll support you through. You don't have to run, you can always overcome everything that you've been through. Share your story here and lay down your fears. We all hear your pain and there's only left to gain. You can get it all right here.
Welcome to Good Things from the Couch. I am your host, Elizabeth Davies, and I am a mental health counselor and an author. And today I have a special guest with me, Jack, who first saw me for counseling back in 2016. At the time that he first saw me, he had been addicted to opioids for about 15 to 16 years. And I'm really excited to reconnect with him today, and he can share his story of recovery that I think is very relevant due to the opioid epidemic we are having in America. Jack, welcome to the show.
Morning. How are you doing today?
I'm doing great. Thank you so much for being willing to be a guest today and share your story with us.
You're more than welcome. Looking forward to it.
I can't believe it's been more than 5 years since you first saw me for counseling.
Yes. Yep. It's been a long time. A lot of water's run under the bridge, and a lot of good things have happened to me since I've spoke to you. I'm just great to have the opportunity to share the my story.
Yeah, that's exciting. I know when I first saw you, you had told me you were worried because you had been addicted to opioids for about 15 to 16 years at the time. And interestingly enough, though, when you came to see me, your goal wasn't to get sober. Your goal at that time was to rebuild trust in your marriage with your wife and to rebuild your self-esteem. So,
correct.
Yes. So at that time, you still thought, "Hey, look, I'm using these opioids. Specifically, you were on oxycodone, you were on Apana. What other opioids were you taking at the time?"
Well, at the time, I was on the oxycodone, Oxycontin, fentanyl patches. I mean, an array of all sorts of opioids that I had been using at various times.
And we should probably let our listeners know what started the use of opioids for you, because I know you've had at the time that you were seeing me, I think you'd had about 28 surgeries, and we know that's the number one thing that doctors after surgery will give you is typically opioids.
Absolutely. It was a number of activities that enabled me to kind of get where I am to today. They were motocross riding, bull riding, football, baseball, you name it. I was into it, and all of those were activities that led to my bodily injuries and surgeries after the fact. So that's one of the reasons that kind of led me down that path, was that playing these activities and just did not sit well with my body.
No, because of a lot of the injuries. Like, it's a high risk, high adrenaline activities that you're doing.
Yes, absolutely. And each of the activities I spoke about, I always had to utilize my body because I was so small and, not very heavy. I was probably 120 to 140 pounds while in high school. So that those high adrenaline activities had led me down that path there to a lot of injuries and a lot of surgeries following up.
Is that what started you on the use of opioids?
Yes, I started with, I believe it was one of the first items was I had a wrist fusion where I was jackhammering into a wall here at my house, and it caught and twisted on my arm and snapped my wrist. So that was the first surgery that started. And from there on, 28 surgeries, anything from neck and neck injuries. I had, I'm working on number 5, complete knee replacement as we speak. So, and I'll talk about that in a minute. So.
But do you think that if you hadn't had any of the surgeries or the pain from the surgeries, you would have started on opioids?
No, I really don't think that I would have, because, you know, I grew up in the 70s and I smoked a little bit of the, you know, marijuana and but again, as I, you know, grew up and became a teacher, those are things that, you know, I had to let go of, you know, growing up. So I had to, you know, I was in an environment where I had to be a role model. So I don't think you know, had I not had all those injuries, I probably would not have ever got involved with the opioids.
Which is good, I think, for our listeners to know, Jack, because back, you know, in the 90s, when the pharmaceutical companies were telling the medical professionals that, hey, opioids aren't addictive, lie. Then the medical professionals somehow believed all of that, and they were prescribing them in mass doses, which honestly, is a huge cause of the opioid epidemic we have in America today, with over 10 million people abusing and misusing opioids in our country today, and over 9.5 million of those people that are abusing and misusing opioids in our country today are from prescriptions from doctors.
Yes, absolutely. And, you know, mine started off with, you know, first surgery, they gave me a prescription for, you know, 30 oxycodones, and then I just began to get that. There was not really an effort to bring me off of those opioids at the time. I mean, it was just, here's your prescription, tell me about it, blah blah blah, and you know, they were on to the next patient. So, and you know, being a teacher and a professor at a local community college, you know, I never thought that I would be one to become addicted to those opioids. But, you know, every time I had a surgery, I got another prescription. And then after the surgery was done, it was more prescriptions. So, it was very, very hard for me to realize that I did have a problem.
Right. Because how many people really think, like, you go to the doctor says, okay, take this medication after your surgery. You don't think like the doctor would be maliciously in any way, and they weren't, you know, prescribing you medication that's so addictive. I mean, addictive within the first 30 days. And then, like you said, they don't say, okay, titrate off. I mean, how easy was it after you used the first 30 opioids from one surgery to go back and get 30 more and 30 more and 30 more and just get it refilled? How many refills were you allowed?
Oh, I mean, back when I was, you know, 16, let me see, you know, 20, 25 years ago, it was just, you know, time after time you got a new prescription, and you just went from one prescription to the next. They called, you know, I had what they called chronic pain, and I really did have chronic pain. And you know, in my mind, I was justifying the use of opioids because I didn't want to be without them, because I was very afraid of not being able to be, you know, have my opioids there. So
because of the pain when you go off of them, right? It's fear of being in pain. A lot of times that's kind of what it turns into. And then your body, your brain is addicted to them. You're physically addicted to them. The withdrawal from opioids is super uncomfortable.
Yes.
I mean, most times they'll tell you to get medical detox. Now, I know today in 2021 that is not the case. Today, with the new laws, because of the opioid epidemic, today they are saying, no, you can't have, you know, unlimited refills on your prescription. So today, now that you had the most recent surgery, what is it like today in 2021? Did the doctor say, okay, no more refills after 30 days? What is it like today?
You know, in today's society, with the opioid abuse, our doctors, at least my pain doctors, I've changed to a new pain doctor. He is, again, building a relationship with me to find out where I have been and, where we're going after the fact. So it's really highly regulated. You cannot get anything more than a 30-day fix or 30-day prescription. And with that in mind, I've been having a lot of face-to-face over my phone with my doctors, and they have spoke to me about, okay, where are we going now? Instead of just giving me a prescription, they talk to me about, all right, let's utilize some other activities, and I think we'll talk a little bit about those, but
non-opioid treatments, yes?
Yes. Non-opioid items that will help me, using ice, essential oils, those types of items there.
Were there times over the years, in the 15 to 16 years you were using opioids, that you weren't in pain, but you just continued to use them now because of the dependency on them?
Absolutely. Yes, that's exactly what happened. I got in the mindset that I had to have those if I was going to work, and in my mind I felt that I was not dependent, but in reality I was very dependent upon opioid use.
Yeah, and that's the thing, we don't know we're dependent, right? Especially if we're getting the prescription from a doctor. And that's another thing I want to say. Okay, so on the times that you weren't in pain, and yet you were still, where were you still able to get a prescription?
Absolutely. I mean, you just go in there, they ask you, okay, on a scale of 1 to 10, what's your pain level? Well, for me, I would say, well, I'm up there, 7, 8, 9, and I can remember my wife looking at me and saying, she'd kind of look at me like, you really don't think that you have a 8 or 9 pain level.
Right.
So, that's some of the things that begin to happen in my relationship with my wife. As a patient, I get that mindset that, hey, it's coming from a doctor, it's got to be okay.
Right. And your doctor, did you ever, like when you started counseling with me, and I certainly brought it to your attention when I did an assessment on what medication you're on, and I certainly many times, you probably remember this, talked about a medical detox and your wife would come in with me, and we'll talk a little bit about your wife and her role in this too, because I think a lot of people that are addicted to pain meds, are in a relationship too, and their partner is witnessing this. But I remember many times talking to you about detox, and even your wife being concerned, like you're saying. And at one time she had told me that I'm locking up his, oxycodone and his prescription pills in a safe where he can't get to them, and I'm monitoring him.
Yes. And
just doling them out as prescribed. Otherwise, you would have a tendency, like you said, to misuse them.
Oh, yeah. Yep. When you have a person, your spouse or your partner, where they have to begin locking stuff up, and it's a problem there.
Yeah.
So, but in my mind, I didn't feel that way.
Right. Today, are you sober today?
Well, I am definitely sober. However, I've had a series of 4 knee operations.
Yes.
Just in the past month and a half. And I am going to continue to have those until I get free from the staph infection that I have.
Yeah.
And so what I'm doing with that is that, my pain management doctor has learned about my history through my wife and myself, and we've been trying to be upfront with everything. And, we had started with a 30 milligram oxycodone and worked my way down all the way into the 15s. So my pain management doctor is very aware of my history and has agreed to work with us on, lowering down the amount of opioid use that I'm currently using. So it's really been a good, for me, I have that better mindset of where I am now and where we want to go. And I think I've done a pretty good job. I really do. I know my wife is a lot happier. I'm happier.
Good.
You know, I'm not having to worry about lying and cheating and doing those types of things that would enable me to get more pain medication.
Yes.
So,
Yes.
so about a year after I started seeing you,
Uh-huh.
I went into detox.
Okay. And what was the catalyst for that? What was the catalyst for detox?
Well, it was my family. It was kind of an intervention type situation. And, you know, I knew it was time for me to, you know, get clean and get on the right side of where I needed to be. Otherwise, I was going to lose my family. Both of my boys came, my wife came, showed up at a place of work where we were spraying at the time. And, you know, they kind of corralled me and said, hey, Dad, you know, it was very much like an intervention type of situation that I was put in to, you know, hey, you got to do this, or, you know, you're going to lose Mom, you know, you're going to lose your wife. So, and I definitely did not want to do that. That was something that I definitely did not want to lose. And so at that point in time, I went into detox, and that was, you know, quite the ordeal in itself. You know, that I thought in my mind, well, you know, they're going to slowly bring my dependence down. Well, in this situation, that's not what they did. They just got rid of all the opioids and began me on a path of getting off of them, getting off of the addiction.
So what did they do for the withdrawal part? Did they give you any medication for the withdrawal?
Yeah, they did. They started me with, what's the name? Zubzol is one of the medicines that they used. And it had a small amount of opioid that, you know, would come out and kind of begin to, you know, they have ranges too, like a 5 grams, and you put it under your tongue, and so go from there, from 5 all the way down to, I was on the 1.25, the lowest level that you can get, or 0.125. So I really had titrated myself down to a good level where I could go in. And I was still on the Zubzol right up until my first surgery. So
from detox to your first surgery, how much time had gone by? So you were totally sober off all opioids from the detox, then your first surgery was how long after that?
About 4 years after that.
Wow. So for 4 years, no opioids.
Correct. Absolutely.
What about the medical marijuana? And the reason that I bring that up is because, now this is back, you know, in 2016 when you and I were working together, when you were in counseling with me. But you had mentioned at the time, now you were still using the opioids, but you had said, hey, you had added medical marijuana to it. Medical marijuana gummies, I believe at the time, to sleep, if I remember correctly. Yeah. And now the reason I bring this up is because so many people have asked me being in the addiction field, okay, don't you think it's better than, since I'm going to go off opioids, now that I can just switch to the medical marijuana? And I kind of have a little bit of a little bit of cautionary, like, that's addictive too. Now, not addictive in the way that opioids are, like no one has died coming off of marijuana that we know. You can't really overdose on marijuana that we know of. You know, it's different. The withdrawals, it's not like people literally die from opioid overuse.
Yes, absolutely.
And they die coming off of that. They're, you know, it's a very dangerous, you know, and so is alcohol. So in marijuana, people are like, oh, it's not dangerous. It's, you know, it's natural. Well, yeah, it is natural, but the medical marijuana is, manufactured, and the THC levels are added and different things. It's not like literally growing natural from the ground in its natural state. We know it has higher THC levels and things like this. Now, we do know, just like the brain has an opioid receptor, which can make it addictive, it also has a cannabinoid. Thank you. Receptor, and it also can be addictive. Not as effective on pain either, I would say, from someone who's used opioids. Is that correct? Would you say that?
That is correct.
Yeah.
That is correct.
But I want you to tell the listeners, because you had used both, what is your advice today when someone is saying, oh, you're right, maybe I am overusing opioids and this is kind of dangerous, maybe I should switch to medical marijuana. What would your advice be today, since you had...
Again, my advice on that is that it will get you addicted. In other words, pulling you in. And again, I think with everything, we have to understand our bodies, and this whole concept of that, a little bit is probably what you need to go through.
Yes.
Well, then your mind says, well, if a little bit's good, a lot would be better. So, it's hard to be opioid free, and again, and still have that addiction in your mind, saying, hey, maybe this will take care of this. I need a little more. So, I've had to be very, very conscious of, how much I'm taking and the reason for them I'm taking them.
So you went through detox, you were sober for 4 years, then you have another surgery, and the doctors still don't know what else to give you besides opioids, even though you've let them know that you've had a history of dependency on opioids. But what other medication are they to give you today? Like, what medication are doctors supposed to give someone after surgery?
That's a great question. And again, each person is going to be different because of their history, maybe family addiction. What are the things that are going on in your life? For me, I had a very supportive spouse, and she went with me to all my doctor's appointments. We began to develop here's a plan of action that we can utilize a small amount of opioids and utilize other things like Lyrica, gabapentin, those types of things.
Naproxen.
That are that are not as addictive in nature, but will help you.
Were you afraid? I know this has happened to other people when I was in recovery groups in the past, and they had been free of opioids for years, and then a surgery was coming up, and they were very afraid that they would get addicted again. Did you have that fear?
Absolutely.
Yeah.
I think you cannot have, you're cheating yourself if you're saying that there is no fear about getting back on the opioids.
Right.
So, and again, each and every person is different.
Yeah.
For me, I have a pretty good thought process and objectives to get me off of the opioids, because now that I have a little cleaner mind, and a very, very supportive spouse, that also has had that, the worry about me getting back on the opioids. So.
Worried about the dependency. Now, I know when your wife first came in, I used to refer to her sometimes as your accountability partner.
Yes.
Which can make it really tough in a marriage, right? Because as a spouse, we're really supposed to be like a friend and a lover, not necessarily the sponsor.
Correct.
And I remember talking to her and to you about that back in 2016, about saying to her, I want, once you and I talked more and more about the dependency, and I think you started realizing, like, okay, this counselor thinks I'm addicted to opioids.
Yeah. Exactly. Yeah.
She keeps bringing it up. She keeps,
That can't be me. I'm a teacher, professor. I'm, out there in the community. They look up on me. You have all these different thoughts going into your brain. So.
Yes. And encouraging you to do detox. I also was saying to your wife, I don't want you to be his accountability partner. I want, and I was saying to you, I want you to get your own sponsor, your own, Opioid Narcotics Anonymous group. I want you to do, treatment. And one of the things you did, you were in counseling with me, but you also did work through my workbook, Good Things Emotional Healing Journal Addiction. Can you let the listeners know if that was helpful at all?
Oh, absolutely. Absolutely. You had a number of things from your note cards at the end of our session. We got to pick out some note cards that were very healing for me as a person. To find out that, I really was a good person.
Absolutely.
My mind needed to be set on what I needed to do to get rid of the opioid addiction. And the workbook served as a kind of a roadmap for me and my wife to kind of go work through and answer some questions and being honest about, what was really happening.
She's been a wonderful support for you. And we also know this. We also know that detox is like the first step to recovery. It's not like the treatment per se for recovery. Like first you go through detox if you have an opioid dependency, then you have the cognitive behavioral therapy or the counseling, you have a sponsor or an accountability partner that helps hold you accountable. Some people do the 12 steps groups or the smart recovery group, or I know I did Women for Sobriety group, which I really, really enjoyed. There's also Celebrate recovery groups. There's so many great recovery groups, and with the COVID happening last year in 2020, a lot of them went online, which didn't help the epidemic of opioid epidemic, because then it's harder to do accountability when you're online, I think, than when you're face to face with someone per se. So we know that's the start of it, but what other things do you think helped keep you sober those years besides just the detox being the first important step in it?
Right. Again, you've opened up a real good question. You definitely don't need to have your spouse be, your opioid regulator. That puts a lot of stress upon her.
Yes.
Or whoever that may be, her or him.
Yes.
And it's just not good for a marriage.
No.
And in my situation, what I did is I had a number of different people out in the community that knew about my situation.
Yeah.
I mean, everybody I go around, I talk to them about this addiction and being opioid free. And so I developed a number of different individuals in different areas that I could go to, or that I saw either on a daily or a weekly, spot that there would be some accountability for me.
We don't realize it's affecting our relationships, because we're kind of being self-centered at the time. We're like, why does it bother someone else if I smoke weed? Or why does it bother someone else if I'm, doing opioids? Like, this is my body, or drinking, or whatever our addiction happens to be, And it's not just substances. People are addicted to food, they're addicted to work, they're addicted to gambling, pornography. I mean, the list goes on and on. Sports, just all kinds of things that distract or medicate them from being present in their life and building healthy relationships. But your wife would probably say, maybe she's told you this, what is the difference now when you got off opioids as a partner? And then you didn't make her, which I encouraged her, I don't want you to be his accountability partner, I want you to be his wife, right? So taking that responsibility off her, and then you going through detox and becoming sober, how did that change the marriage? Because that was one of your goals, is to rebuild the trust.
Absolutely. And we still deal with that, in certain situations where that trust is, there's been so much distrust in my past relationship with my wife that, I have to work through that with not only, my thoughts in it, but, you have to begin thinking, how is this affecting, my spouse, my children, my, people that I deal with.
Yes.
So, very, very important that you look at that from outside of just your point of view.
Yes.
One of the boundaries is that she's not doling out my medication.
Right.
So, I'm a big boy. I need to step up to the plate, and, it's
true.
Part of that relationship that you have as a husband or whatever whatever situation you're in,
Yeah.
your partner, whatever. It's something that really needs to be managed, and
Yes.
and I need to, step up and begin being that person that I should be.
Being accountable for our own behavior, right? Some people call it adulting.
Right.
And how do we realize we have a problem? In most cases, it's that consequence. I've never heard of anyone yet in recovery, and I've talked to hundreds and hundreds of people in recovery, clients and people in recovery groups. No one has said to me yet, you know what, nothing happened, everything was going great, and I just decided to stop using one day. It usually is the consequence, like you said, the relationship is the consequence, or the health. We have health problems now, or we have issues with losing our jobs, or it affects our finances. It's going to affect one area of our life in a negative way, and then that consequence becomes greater than the reward of using.
Correct. Absolutely.
And we should let the listeners know, so that if people are listening today and they don't have an addiction, but they're with a partner or a loved one who has an addiction, and they say, why does this person keep using? You know what? It is a reward. It does affect the reward center of our brain. Whether the reward from using opioids is no more pain and numbing out, or the rewards of alcohol is like numbing out your problems, or, releasing dopamine in your brain so you feel a feeling of pleasure and it changes your state of mind. Or gambling, where people win money. It's like, or pornography, it stimulates our pleasure center, and that's why people keep reusing. They like that feeling when they first use, and they want, like you said, more and more and more. They say, if a little bit of this gives me this much pleasure, how about more and more and more? And that's where we start going down the road of the slippery slope of addiction, right? And dependency on it. Because then, as we know with the dependency part, there are consequences in our life.
Right.
Yeah.
Absolutely.
Yeah. So let's wrap around, Jack, to the part we started with about giving the listeners some other options. You and I had talked about this several times when you and I were in counseling. What are some non-opioid treatments for people who are interested in getting off opioids? Of course, hopefully medically supervised is what I would always recommend 100%.
Right. Absolutely.
So some of the ones you and I talked about were stretching and movement, and rest and physical therapy, and essential oils was one of the ones you brought up, and TENS therapy. I remember when you were in counseling with me, we brought up TENS therapy and you tried that. Do you want to tell the listeners anything about that treatment?
Yeah, the TENS was another element that I put into my regimen to kind of keep my pain level down, and that really worked well with me. It was a little TENS unit. I don't know what the TENS stood for, but it's electrical pulsates that you put to a positive and negative on your leg or wherever your pain is, and it's electrical stimulation, and it worked great with the addition of the essential oils that we worked on, some of the just stretching and things like that really enabled me to bring that level of pain down and get my mind on other items of how do I get how do I lower the opioid use in my life.
I know Dr. Mel Pohl was one of the people that I read his book about. He did at the time run a pain clinic up in Nevada and wrote a really good book about it, and I went to some of his workshops and seminars, and he was saying movement is number one key too, because then it gets more blood flow and oxygen into those areas that are really painful, like the stretching and the movement. Well, I'm going to be interested in the future, and I don't know if you will be too, Jack, if because of the opioid epidemic and so many people dying. I wrote this down when I was doing some research about this. 70,630 people died from opioid overdose in 2019.
Man. Wow.
Right? 48,000 deaths in just 12 months from overdosing on opioids in 2020. 40% overdoses were from prescription medications from doctors.
And again, in my situation, my pain management doctor, well, let me back up a minute. First and foremost, my primary surgeon that was doing my knee said, you need to have somebody outside of hospital here that's going, you need a pain management doctor that's going to pick you up after you leave the hospital to kind of keep you going.
Yeah.
And again, that's what I used. I used a pain management company or doctor that knew all about my background.
Excellent.
And with that in mind, utilized other, activities that would eliminate some of that chronic pain. So we would begin up here at a certain level, and we had goals every time. Okay, next time we're going to go down, we're going to titrate down and really have a plan of action.
So it is like the responsibility of the person, to tell the doctor that and to say, hey, what other options do you have for me? Because I already went through detox. I already went through treatment. I don't want to get re-addicted to opioids and go through that again.
Right. Yeah, absolutely. You don't want to be pulled down into that. It's like a funnel.
Yes.
You're out here very wide, and then the next thing you know, you're spiraling down in that addiction again. And so, it's got to start. It can't start with the day that you enter the hospital. You've got to do a lot of research. Number one, with your pain management doctor, they're going to be on board with what your objectives are, and what's your doctor, what's your hospital going to do. They all have to know the role that you've been in, and I try to identify certain things that have really helped while I'm in the hospital. Essential oils was one of the things that really for me made a difference, because you get in that hospital environment, you think, oh, I need a pain pill now, and this and that. Well, if you go into the hospital and you got your room in there and lots of essential oils being used in the room, you kind of go back to that mindset of, oh, this is like home. This is what we do at home. So, it really keeps you on board of your objectives.
I remember your wife bringing that up when she had come into counseling with you. I remember her talking about essential oils at the time. Is there specific ones that help with addiction more that you found help with the opioid recovery more than other ones, or help with the chronic pain more than other essential oils?
Yeah, there's two that I use on a daily basis. Well, three. The pain or the peace and calming would be one. Number two is a stress away. And then the third one is the deep relief is one that I use. Some of the doctors that we speak of, all they know is, oh, we're going to give you another pill for this, another pill for that. When you get into a situation where you need a doctor, you really need to kind of do a, an interview with that doctor.
Yes.
What are the things that you use to use for pain?
Yes.
Do you have anything outside the standard prescription?
Right.
So you really need to do that on your own. Because
I think that's a great advice. Like we interview counselors, maybe to find a good counselor, interview doctors and find out if that pain management doctor uses things other than opioids for chronic pain. That's a super good piece of advice.
Absolutely. You need to be your own advocate.
Yes.
Advocate of taking care of your body after the surgery.
Yeah. Well, that has just been a delightful conversation, and learning so much, really good information. I really appreciate you being willing to share your story with people and your recovery and where your life is today in such a better space. It gives people a lot of hope that you really can come off of opioids. You really can be free from opioid dependency and addiction and continue to have a good marriage and a good relationship with your family. Well, thank you so much, and thank you to the listeners as well, and may good things continue to come your way from the couch.
You are not alone, I'll support you through. You don't have to run, you can always overcome everything that you've been through. Share your story here and lay down left to gain. You can get